So hey guys, what's up? It's Stephen Dunn with CORE Therapy and Pilates today, and what I want to do is interview Dr. Danny on his most recent education since he's been with us at CORE. So first of all, Dr. Danny, thanks for joining us today.
Sure.
And he's been working with us now for I think about 5 months.
6 months.
6 months?
6 months.
In that time that he's come on board to work with us, there's been a lot of educational opportunities that's already that he's already taken advantage of. And one of the things I like to do is get together and have a bio update. And we can update the bios on the website, but I like to just kind of have a discussion and talk about it because it goes into a much greater depth. So now I want to talk real briefly about craniosacral therapy, because craniosacral therapy is something that I've been doing, something I've been doing for a long time that I learned from John. We did not touch base on any craniosacral therapy in the course over the weekend, but me and Danny have been doing a lot of talking about craniosacral therapy where I'm doing it to him and he's doing it to me, so I am mentoring him in that piece. So with that said, tell me, I know you don't have, again, a formal training on it, but from your experience with me doing craniosacral with you, me doing it with you, and you doing it with some of your patients, from what we've learned, tell me just a little bit about that.
Yeah, so, once again, it's another one of those, very, gentle, kind of, subtle, so it's not as, I've used it, a lot with, I've used it with some of my patients that have balance issues, or some of the ones where if they have dizziness or nausea or anything like that. So it's been, and then me personally, having it done, it's just kind of helped kind of just free up restrictions, and kind of is good for utilizing with kind of calming the nervous system down, really being in that fight or flight mechanism where you're just kind of always this, and you got cortisol pumping through your body, so it's one of those subtle things to just kind of make a little subtle changes to kind of just calm your nervous system down, and kind of get that parasympathetic system, that rest and digest, instead of the fight or flight.
I like that. And so when you first laid down on the table, you were laying there kind of expecting to not feel anything. You admitted that to me. But what did you end up feeling that very first time?
So some of it was I could feel my whole body tingling.
It was his whole body, everywhere.
Yeah, just everywhere. With certain ones, I would feel. That was the main thing that I remember. I remember feeling it some other places with some certain ones, but there was one in particular where I just felt the whole body just tingling, which I was not really expecting.
And I went into my first course with craniosacral work and was a little skeptical. I was definitely, and I laid there and had powerful things happen. And when he laid there that first time, he was skeptical. He heard me talk about it. He sees people come in and see me when we do it. So he knows that there's some value to it, but until you lay there and experience it, it's kind of hard to understand when we're doing such subtle, gentle things. It looks like we're doing nothing. It really does, but we're not. We're doing something. But with that experience of him laying there and he goes, man, I feel this over my whole body. I was like, oh, cool. Now it's much easier to buy into something and trust something and deliver something effectively when you actually experience it yourself. And a lot of things we learn in PT school, I don't think we ever get to experience and learn from a personal, oh, that helped me. Therefore, it's hard to go do those things to other people when it didn't help ourselves. So that's just kind of my take on it. I thought it was really cool. I knew we were on just some good stuff when he laid there and had that experience on that table, along with my first experience. It was pretty powerful. So with that said, thanks a lot for your commitment to getting better and serving the people of Westlake and Austin. And if you haven't been around and seen Dr. Danny, then give us a call and get on his book. He's got some great Google reviews so far. We'll post those at the end of this video. But thanks for watching, and thank you, Danny, and we'll see y'all around.